Hello, everybody. Hi, everybody. I'm here with Andrew Vasta. Welcome, Andrew, to Ride to
Hi.
Independence.
Yeah, thanks for having me.
How are you this hot day?
Yeah, trying to stay cool. It's like I gotta
Okay.
hit 97
Okay.
today.
I know. We're going to jump right into the questions. So tell me, Andrew, uh, how long have you been a Medicare broker?
Yeah, I like to joke that I've been doing this since I've been in diapers, but I've been doing it for 16 years.
Wow.
And been yes, helped thousands of people with their Medicare option. So,
Yeah.
seen pretty much every situation.
Do you also do virtual or you're just local? I know that you're licensed in New Jersey and Pennsylvania, is that correct?
Correct, yeah. I used to meet everybody in person, but I mostly do virtual now after COVID. More people are able to do things over the phone or with
Right.
Zoom or whatnot.
So anybody in New Jersey or Pennsylvania, you can help.
Correct.
Okay, great. Okay, great. So tell me, Andrew, who qualifies for Medicare?
Yeah, so Medicare is for people over age 65. So anybody turning 65 qualifies for Medicare, or if people are disabled, once they're on Social Security disability for 2 years, they qualify for Medicare.
So if I'm a disabled person, if I'm on disability and I'm turning 65, do I get disability and Medicare?
You would have gotten Medicare under age 65 if you've been on disability for 2 years. So even if somebody's 20 and they're disabled, they can qualify for Medicare.
I see. I see. You're calling it Medicare. I'm calling it disability insurance.
Well, it's not disability insurance. It's
Oh, okay.
it's Medicare is health insurance for people that are 65 and older or on Social Security disability if they qualify because of a disabled. Um, if they qualify for Social Security disability, then they can also get Medicare.
Okay. Okay. Good. I'm glad we got that straight.
Yeah.
And when do people apply for Medicare? Do I have to wait till I'm 65 on my birthday? Then I put the application in?
So for people that are on disability, they automatically get enrolled in Medicare. They don't have to do anything.
Okay.
And then for people that are turning 65, if they're collecting Social Security benefits already, they also automatically get enrolled in Medicare. And then if somebody is not collecting Social Security benefits, they can apply 3 months before their birthday month, the month of, or 3 months after. So you shouldn't actually, unless you want Medicare to start the month after your birthday, then you should apply before your birthday month because it will start the first day of the month of your birthday. Um, and there's many parts of Medicare, and whether you should be taking all the parts of Medicare when you turn 65. Some people are still working and have insurance through work, and they can delay Medicare enrollment until after they retire. Um, of the time, it makes sense to take just Part A of Medicare in that situation, which is Medicare A is for hospital coverage. There's
Mhm.
no charge for Medicare Part A, so it makes sense to have the employer coverage and then that as a secondary for hospital stay. But the Part B of Medicare is for medical, and there's a monthly fee for that. Most people pay $185 a month for Medicare, but Part B, and you can delay that as long as you have creditable employer coverage and your employer has more than 20 employees. It's a lot of like caveats with Medicare, but
Well, this is why I have you here because
yeah,
I
exactly.
want but hold that thought because you said
Yeah,
something interesting. So, if I collect my Social Security early,
yeah,
not that I am, I'm not in my I'm not doing it. So, if anyone who's collecting their Social Security from
yeah,
62 on,
correct.
they automatically will be on Medicare when they turn 65?
Yes,
Automatically, so they don't have to fill out any paperwork?
they don't have to fill out any paperwork to get the Medicare Part A and B, and then they can add on from there,
Okay.
and they'd have to fill out speak with myself or a broker to add on the additional coverage options, but just what they get from the government, Medicare Part A and B, they'll get a card automatically in the mail.
Oh, well, yeah, for people who are taking Social Security. But if you're
Correct.
not taking Social Security and you're delaying Social Security to your 65, 68, 70,
Yeah,
then you
whenever good.
have to apply for Medicare. 3 months in advance of your birthday.
Yes, if you want to take Medicare on your birthday month. If you want to
Okay.
delay it, then there's whenever you're retiring, at that point, you can apply for Medicare through your local Social Security office.
Okay, but won't you be penalized if you don't take Medicare at 65?
There's a lot of, literature out there saying that, and they say even on the Medicare website, make sure you apply for Medicare. Um, you If you don't have any insurance, then you'd be penalized, and you can only enroll in certain times. But if you have employer coverage
Mhm.
and your employer is above 20 employees, you don't have to take Medicare when you're first turning 65, and you won't be penalized for not having the, Medicare. Whatever you retire at that point or your spouse retires, at that point, you can apply for Medicare. You won't be penalized. Your
Okay,
employer has to fill out a form, and it just says that you've had insurance through them,
right.
but that avoids the penalty.
Okay, that's what everybody's terrified of,
Yeah, I
getting
know.
penalized because they don't get on Medicare, but it is mandatory to be covered one way or the other, either through your employer, and if you're not, if you're self-employed, then you have to get on Medicare. You cannot delay it just because you wanna delay, you say, "Oh, F it.
Yeah.
I don't
Yeah, yeah.
wanna do Medicare, and I don't need to be covered."
So, yeah, you
Can people think that way?
the people some people are on the Affordable Care Act, and they may be paying very little for it because they get subsidies to help pay for it, and they're like, "I'd rather just stay on this insurance than go on Medicare because Medicare is gonna cost me more." You can't do that, because you lose the subsidies, and then
Okay,
you're gonna be paying a whole lot more for the Affordable Care Act plan. The only situation where you can delay it is if you have an employer coverage and you work for a company that has more than 20 people there.
okay, okay. Well, that makes sense, but my you said you don't Medicare doesn't cost you anything, and then you said something about $185 for
Well,
that's Plan B? Can you just said Medicare was
yeah.
you
Yes, let's
basically
step
said
back.
Medicare was free. I know it's not free because it comes
Well,
out
it
of your
depends what
tax.
part of Medicare.
Excuse me?
Depends what part of Medicare.
Okay. But
So
Medicare A
is for hospital, and as long as you or your spouse have worked in the country for 10 years,
yes.
then it's free.
Okay.
And part B is for medical, and that's not free.
Okay, so the medical's not free, and that is determines how much is that then? What determines that rate?
Yeah, it's based on your income from
Okay.
2 years ago. So,
Oh, from 2
right now it's
years ago.
2025,
Okay.
so they're gonna base it on your 2023 income. If your income as a single person is less than 106,000 or as a filing jointly below 212,000, then Medicare costs $185 a month.
Okay.
If you have a higher income, then they add a what's called IRMA, income adjustment, on top of that, and there's a lot of brackets from there that Medicare can get very costly if you have a higher income.
Uh, I'm sure, I'm sure.
Yeah.
What's the highest Medicare that someone can pay?
If your income's above 500,000 as a
Yeah.
single or 750 as a 750,000 as a married couple, I don't remember offhand the number, but it's around $600 per month.
If you're making that kind of money, then why even get on Medicare? I mean, that means you probably can't afford a hospital, a
You can
doctor,
well, yeah,
surgeries.
but you the bills for the hospital stays nowadays are just
That's
outrageous,
true.
and
That's
so
true.
you don't wanna get stuck with the
Right.
$1,000,000 bill for a hospital stay.
Right. True. True. So when I'm in my 60s, and I want to get plastic surgery, will Medicare cover me for that?
No, it will not.
What?
Cosmetic
It's
cosmetic
a
procedures are not covered.
necessary thing. Andrew, us women need it. It's a necessary
Uh,
thing. How about if
yeah.
my breasts fall down to my belly button because I breastfed, 3 or 4 kids? Are you telling me that's not necessary? Come on, we gotta
I
fight
don't make
that.
the rules, but yeah, it's not gonna be covered.
Do you actually fight the government for Medicare for some of your clients on a serious note?
Yeah,
Is
I
that
mean,
what you do as a broker?
there are situations where things that should have been covered are showing up, and they're saying they're not gonna pay for it, so there's an appeal process that I help people with,
Okay.
and and, yeah, it's medically necessary things that unfortunately, cosmetic things are not covered.
How about Ozempic? How about for someone who's obese and needs to lose weight in order for them to get into their golden years a little bit more healthy?
Yeah,
How about that?
yeah. So Medicare, uh, covers Ozempic for
Oh,
people with diabetes,
okay.
but not
Nice.
for weight loss itself. So if you're just taking Ozempic or a similar medication for weight loss, it's not covered.
Okay, but you
At
see,
least
that
at
makes no
least
sense because
yeah,
it's a
I know.
preventive.
I
Okay?
know,
It's a
I know.
preventive. Don't you want to lose weight so you do not enter into diabetes or
Yes,
other ailments? Doesn't that make sense?
makes sense, but, the insurance companies provide the prescription coverage,
Right.
and the insurance companies don't wanna have to pay for it. So
Right, right, okay. Okay, so how about if I wanna get a little frisky in the bedroom, do you guys pay for, like, stuff that I might need to help me with that?
typically, no.
Ah, what? Alright. Alright. So what are the different options that someone on Medicare can choose?
Yeah, so when people turn 65 or they qualify for
Mhm,
Medicare, they have the option to go with Medicare as the primary and add on a supplemental insurance, also called Medigap. And they're through private companies where Medicare pays first, that plan pays second, and there's very little out of pocket costs as they use the coverage, but there's a monthly fee. So they're through private companies. It's called Medicare Supplement. And then you need a separate plan for prescriptions. So you have Medicare plus a supplement plus a prescription plan, and then dental would be separate as well. Everything's kind of piecemeal. The other way you can go is Medicare Advantage, where you combine your doctor, hospital, and prescription coverage, and it has additional benefits. A lot of the plans have some dental and vision included, all wrapped into one package,
mhm.
and they're through private insurance companies. So there's pluses and minuses of both ways of going, but it's about half the people go one way and half the people go the other way.
Mhm, mhm. So, but what about if you can't afford all those extra options?
Mhm. Yeah, the Medicare Advantage plans, if you can't afford the supplement coverage, then you can go with Medicare Advantage. There's a lot of plans that are no monthly fee in New Jersey.
Oh, okay.
So you still have to pay for Part B of Medicare. I mentioned before it's 185. But on top of that, there's plans that are $0 per month, and they do have copays and out-of-pocket expenses as you use it,
Mhm.
but you're not having to lay out a monthly fee, and it does have some extra perks that you don't get with the original Medicare.
Okay, okay. And but tell me, what is the most common mistake that most people make, when enrolling in Medicare?
Yeah, everybody's situation is different. Uh, a lot of people just either don't enroll, or if
Mhm.
they're on Cobra, they take Cobra instead of Medicare.
Right.
Some veterans decide to not take Medicare because they have VA benefits, and then when they do apply for Medicare, there's penalties. So the most common mistake is not talking to a professional that does this every day and that
Right,
knows the
right.
whole alphabet of Medicare, because it's not a one size fit all program. And as anybody that's on Medicare knows, when you first are turning 65, you get bombarded by mailings. And every fall, there's the enrollment period where there's so much advertisements, and they all say all the benefits of their plan, but not the drawbacks. So, the speaking with somebody that knows what they're doing and not just going to steer you one way or the other.
And that's what you do.
And that's what I do. Yes.
Now, do I pay you? Do do you have a fee?
No, there's no charge to work with us. We get
Okay.
compensated by the insurance companies if you enroll in a plan through us.
Okay. So you're saying that when I turn 65, I can get Medicare and the hospital, that's free.
Yep.
Well, not actually free. My taxes actually always have paid for that. Let's
Yep.
let's be honest with that.
Yeah,
So
exactly.
right? So I will get the hospital. And let's say I don't want the medical. I rather pay out of pocket on my medical doctor's appointments. But I do want the prescription. Is that an option too?
Yeah, you can take the prescription coverage without Part B of Medicare, but
Okay.
that is definitely not advisable because,
Oh, why?
well, you may not go to the many doctors today, but if some diagnosis comes up, you're gonna need a lot of treatment, then you have no health insurance for the Part B of Medicare, and,
But you said the Medicare A covers the hospital. Oh, so you're saying that doesn't cover the doctor's fees.
yeah,
That
correct.
doesn't call for the anesthesiologist. That doesn't
Yes.
cover for all those extra things that you
Yep,
need.
yep,
Okay,
yep, just only, the hospital itself.
okay. Which can run into hundreds of thousands anyway.
It can Yeah, that can be very costly, but all these doctors add on from there, so either way, yeah, it's very
Right,
expensive.
right. So tell me, what's the biggest misconception about Medicare that drives you crazy?
Well, there's so much false advertising out
Oh,
there
okay.
with Medicare. People get in the mail that when they turn 72, that they now have new plans available to them and they can reduce their Medicare premium, and
Well,
it's just a
62.
bunch
You
of
just said
BS.
70. You said 72.
Oh, whatever age, yeah.
Oh, okay.
People get all these mailings. I've been getting a lot of pictures from clients that say, "Is this real?" And I have to respond and say, "No, it's just a scam." It's not a scam. They just want you to call them and then they can shop your Medicare plans, but the they're not truthful about the advertisement that they're sending. There's a lot of regulations with Medicare with
Okay.
what agents can say, but so many uh, of these 800 numbers that are advertising on the TV just say you get everything in the world for free and you don't have to pay anything, and it's not that easy. You might get more dental there, but your doctors don't take it. So
Right, right.
it's
Are seniors being scammed right now when it comes to Medicare? I mean, are there people trying to pretend maybe they are Medicare brokers? And do you see any of that happening right now?
yeah, absolutely. It does happen. Not every broker is up to up to par, and may just be signing people up without the full understanding of the person's situation, or steering people towards one company or another because they may make more money with that company. Uh, and and there's also been different data breaches with
Mhm.
insurance carriers where their Medicare numbers are compromised, and so they have to get a new Medicare number in the mail and go through a whole process for that. So, yeah, it's important to make sure that you're not just people who have memory loss.
Mm.
Uh, Unfortunately, they get all these cold calls, and they somebody calls them and tells them, "Hey, you're going to get some more vision benefits if you switch," and they may not remember talking to that person, but they switched their insurance
Right,
over the phone,
right.
and then their power of attorney calls me and says, "My mom or dad did it again. They switched their insurance without
Oh,
talking to
wow. Yeah. So you're talking about dementia. You're talking
me."
about
And
people
yeah,
who might have
Alzheimer's,
dementia.
correct, yeah.
And that's when the children need to come in and help the parent to make sure that maybe they're screening those calls or not allowing their parent to take those type of calls and say, "Hey, mom and dad, your Medicare's taken care of. There's nothing you have to do. Don't talk to anyone who calls
Yeah,
you. You know,
yeah,
you are covered. You are covered. So please do not take those calls."
you got it.
You know? Another question is, medication.
Mhm.
If I want medication covered, is that a different plan?
Medicare Part D
Oh,
covers
D,
prescription
okay,
coverage,
okay.
and, so if you do the piecemeal where you have Medicare itself and then add on a supplement and the prescription drug plan as its own entity, they're through private companies, and all there's regulations that they have to stay within, but, each plan is a little bit different. So one plan might cover a medication at no charge, another plan might cover a medication at $30 a month, so it's important to shop around the prescription coverage. With Medicare Advantage, the other way you can go, it
Mhm.
includes the prescription coverage in the policy, so you don't have a separate plan for prescriptions.
And does Costco take Medicare?
Does
For medicine, because I know
Yeah,
they
yeah,
have a pharmacy.
yeah, they have a
Okay,
pharmacy, and each plan has preferred pharmacies that you pay the lowest price at,
okay.
and standard pharmacies that you can go to still but pay more, but Costco is preferred with a lot of options.
How about Amazon? They're getting into the
Yep,
prescription
yeah.
business.
Amazon Pill Pack, yeah,
Okay, that's cool. Now when you said medication, so does medication pay for Viagra?
typically not.
What? You see? That's a that's another medication that's needed. Viagra is very important for men.
It is, but, I yeah, I agree, but
It's
it's
just a
not.
no. It's just a no. So anything that has to do with pleasuring yourself or helping you enhance yourself or helping your sex life, none of that is covered. That's a shame, Andrew.
It
That's
is,
a shame.
it is.
What do these federal employees, I mean, don't they need this stuff too? I don't get it. I don't get it. Another question is what's going down the pipeline with Medicare? Is anything gonna be changing in the next year or so that we should be thinking about?
Nothing significant in the near future. There was recent changes, for 2025, there was a cap on prescriptions of $2,000 is the most you can pay on medications. So that was a change. There used to be
Well, that's
prescription.
what,
Mhm.
Biden
Correct.
had, taken care of, or at least tried to
Yeah.
put into law. He did
It's
actually, didn't he?
part of
Yeah.
the Inflation Reduction Act was
Okay.
limiting out-of-pocket costs for
That's
prescriptions
right.
and
Yeah.
having a cap of $2,000. So, used to be where people paid a certain price for the medications, and then when they hit what's called the donut hole, the price would jump up,
Right.
for brand name medications. That's no longer the case, and now you pay a straight copay or percentage the whole year, and if you hit $2,000 out of pocket, then you're done for the year, you don't owe any more.
Okay, well, I mean, I like that. I like
Yeah,
to know that there's an actual max that, we
yeah,
can pay out.
absolutely. Some of these medications that, somebody that's really sick has to take are just outrageously expensive, and there was no cap before, so they would just pay and pay and pay.
Well, wasn't there a cap that Biden brought in about $35?
That's for insulin.
Oh, that was for insulin, right,
Mhm.
right.
Yeah,
Is that still in law or
it
that
is.
was what okay,
Yeah,
so
that's
that
not
hasn't been
changing.
touched. Okay,
Correct.
so people who need insulin is $35 if
Yep,
they have Medicare.
correct. I
Okay.
think also if you don't have Medicare
I was gonna
too, it's
say
gonna
even
help.
if you don't
Yeah,
have Medicare, right?
yeah.
Okay. Okay, cool. Yeah, that's good to know. Oh, one of the things I want to ask you also, there's a lot of older, adults, I should say, in their 60s that are parenting now, right? They're having babies. Are their babies covered? Are
Uh,
children covered?
Good question. So, no, Medicare is an individual program,
Okay,
so you
individual.
can't
So it doesn't
have.
extend to family.
Correct, you can't have your spouse on the coverage unless if they qualify for their own Medicare
Okay.
based on turning 65, then but, families are not covered by Medicare.
Okay, so if I'm 65 and my spouse is 65, we're both covered, but we have our own Medicare. So there's not a Medicare family
Nope,
like for me and my husband,
correct.
or me and my partner, or me and my
Yeah, no, and some plans will have a discount for the supplemental insurance. We'll have a discount for husband and wife taking the same insurance company, but other than that, there's no family plan.
no family plan. Okay, that's a shame.
Yeah,
It should be
well,
it,
it's
it should be combined because obviously you're husband and wife. You would think that you would have like a family plan, just like there's a dental plan, right? There's a family dental plan. There's all kinds of different plans for families.
yeah.
Phone service is a family plan. You get a discount when you do the family. No? No?
No,
No?
it's
No? No.
yeah, because it's you
Okay.
have to they have all these regulations where you have to turn 65 to get Medicare, so once you're both 65, then you can individually get Medicare, but
Right.
until then, you can.
Right, right. Okay, well, alright. But, so tell me, Andrew, what do you personally do when you're receiving plans, for your own family or your loved ones? What
Oh,
how do
well,
you how do
yeah,
you assess that?
I get my personal coverage through the Affordable Care Act, Obamacare, and,
Okay. Me too.
Hey. Yeah,
Me
pay a
too.
lot of money for not that good of insurance, so
Yeah,
it is what it is, so
yeah, yeah, no, I know, it's daunting what we have to go through, and, I deal with seniors, I'm in the senior concierge service, and I
yeah,
deal with a lot of seniors who have Medicare, and Medicaid,
okay.
but you don't deal with people with Medicaid, correct?
Well, if people have Medicare and Medicaid, there's plans that are available to them that are designed for their situation, and they don't have to pay the cost for Medicare, the $185.
Oh, okay. If they're on Medicaid.
If they're on Medicaid, the state will pay
Okay,
it for them.
okay,
But if somebody just has Medicaid and not Medicare, then I can't help them.
okay. Okay. And, okay, because a lot of my seniors are kind of running scared right now because of what's happening
Yeah,
with federal government and losing their Medicaid.
yeah,
And there's people also coming to me and asking me, "Hey, am I gonna lose my Medicare?" I don't think Medicare is gonna be touched at
they're not gonna
all.
touch Medicare.
They just need to stop going into the bank and hitting it is what they need to stop doing. Leave it
Yeah,
alone.
yeah. I know. I think they did just say that the Medicare will run out of money by 2034, I think it was, and that was a year less than what it was before. So they always have a way of extending it, but uh, they they need to fund Medicare going
Oh,
forward.
absolutely, absolutely. I definitely agree. Well, Andrew, it was so nice talking to you. You
Yeah.
answered a lot of great questions. I will put your information in the notes. So if people want to reach out to you from the New Jersey, Pennsylvania area, please
Yep.
give Andrew a call. There's no charge, people. Andrew works, so you're commission based, basically.
Yes. Correct.
Okay, so Andrew's commission base. So let's help support Andrew, and he'll
All right.
support us with getting us the correct Medicare that we need and all the
Yeah.
different plans. But thank you so much. You stay cool. Anything else you want to add before we close, Andrew? You don't have any Medicare jokes that you want to share, do you?
Nothing I can think of, but I
Okay.
appreciate you having me today.
Well, of course, it's important that people get to know you and get to know that you can help them with Medicare because a lot of people, it's so daunting to them. They're just like they don't know what to do, but you can answer all their questions. You can steer them in the right direction and make sure that, they get the right plans for themselves, for their spouse or their partners,
Yeah.
right?
Of course.
Excellent. Well,
Pleasure.
Andrew, you take care. Thank you so much and you
All
stay
right.
cool.
You too. Bye, Trish.
All right, bye-bye.